A very good afternoon and welcome to The Nation. I'm Tamina Kausji, and in our studios at Banama, we have with us today Dr. Lim Sien Han from Tun Hussein Onn National Eye Hospital, who will be talking to us about glaucoma, especially in conjunction with World Glaucoma Week, which was just last week. Right. Welcome to the studios, Doctor.
Hello, good morning. Afternoon.
Right. Thanks for making the time to come in.
Sure, thank you.
All right, so just tell us a little bit about your professional medical background and what you've been doing.
Sure. So I'm one of the doctors that work in the Tun Hussein Onn National Eye Hospital, or we like to call it TONE sometimes.
Okay,
I'm
all
one
right.
of the ophthalmologists there, and I subspecialize in glaucoma.
In glaucoma.
Right, that's right. So there are 3 of us working there in the hospital, and we see glaucoma patients from all over the country as well as internationally as well.
Ah, I see. All right. So now, as a rough average from the statistics that I read online, about 2% of any given population may be affected by glaucoma, especially those over 40.
That's right. That's
Right.
right. So generally, the statistics is 2%, 1 to 2% after the age of 40, and so we actually advise anybody above the age of 40 to have an eye check.
Right. So this would be the regular annual eye exam.
That's right. It affects everybody, men or women.
Men or women as
That's
well.
right.
Right. Now, I'm sure that many people, especially those who are concerned about their eye health or people who do actually wear glasses or contact lenses, they've heard of the term glaucoma, but not many people know what is glaucoma.
Sure.
Let's start off by defining glaucoma in
Right,
your
that's
words.
So glaucoma is actually a very important disease for an ophthalmologist and for the general public, in the sense that it's a very complex disorder.
Okay.
That affects the nerve at the back of the eye,
All right.
and which can be related or be independent of the eye pressure. So
I see.
So our eye itself per se has an eye pressure that we call intraocular pressure, and we measure it during an eye visit. So glaucoma, what happens is that the nerve gets damaged, and some of us have a raised intraocular pressure, and some can be even have damage when the intraocular pressure is normal as well.
Right, okay.
Right.
So glaucoma often occurs because of intraocular pressure, but not always.
It's associated with, but
Okay.
it does not necessarily mean that it is. It must have a raised intraocular pressure to have glaucoma.
Right.
In summary, actually, glaucoma is actually a problem of the nerve of the eye.
Problem of the nerve of the eye.
That's right, or the optic nerve.
Of the optic nerve. Okay. Now, well, glaucoma itself, it rarely ever presents any symptoms.
Right.
So, how exactly would the general public, in that sense, go about making themselves more aware of a
Right.
silent killer almost?
Sure. That, as you mentioned, silent killer. So that's actually very good. So it's usually termed the silent killer or sneak thief of sight, actually, because in the majority of cases in early glaucoma, there
Right.
can be no symptoms, right? So the patients do not actually know that they have glaucoma until
Right.
they visit an eye doctor.
Okay.
So, but once it affects your vision, or it causes blurring of vision, it's usually at a moderate or late stage, and at that time
Right.
already, sometimes it's very difficult to treat. So actually you have to catch it early, and at early stage sometimes there are no symptoms.
Right. Okay. So basically, the best thing to do would be to go for your regular eye
Examination.
appointment.
That's right. That's
Right. And how often is generally recommended?
Well, we usually advise everyone to go for an annual eye examination if you're over the age of 40.
Right.
Right.
Annual.
And annually. And depending on what you have, sometimes it might be even more frequent, perhaps
Right.
twice a year, or even sometimes 4 months once.
Right. Okay. And what about individuals who wear either contact lenses or spectacles to correct their vision? Should they go more often for exams, or should they just go annually?
Well, again, it depends on the degree of the short-sightedness or the problem.
Right.
So we do see that the certain types of glaucoma are more prevalent in patients with, like for example, high power of high myope or very 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 thick glasses.
I see.
So if they do have conditions like that, we have to examine them more frequently,
Right.
probably
Okay.
6 monthly or so.
So generally, a good starting point is an annual exam.
That's right.
All
That's
right. Okay. Now, what are the different types of glaucoma, or is there only one type of glaucoma?
Well, by far you can actually, the commonest is actually the open angle, primary open angle, or glaucoma. Actually, you can divide them into either a primary or secondary.
Okay.
And the commonest one that we tend to see is the primary glaucoma.
Right.
And in that primary glaucoma, the most common is the primary open angle glaucoma from studies that have been done. Although we do see the other type, which is the narrow angle glaucoma, more in the Asian populations here, like in Malaysia,
Right, Singapore,
and
regionally.
That's right.
Right.
That's right.
Now, what is primary open angle glaucoma?
So primary.
It sounds like a very big medical jargonish sort of
Yeah,
term.
that's
So, for
right.
our viewers out there, how would you break it down?
Well, primary open angle is what we see most commonly. So in the eye, we actually have this fluid in the eye. We call it the aqueous humor, which generates an intraocular pressure in the eye, and that drains out through the trabecular mesh or the angle of the eye. So in some people it can be open, or in most people it should be open, and some people it can get narrow. So
Right.
if it's open, then we call that a primary open angle, and if it's narrow, a primary angle closure glaucoma.
Okay.
Right. So the commonest is still primary open angle glaucoma, and we usually tend to see this in the elderly
In the
populations.
elderly.
Yeah,
Right.
that's right.
So, is the age a factor in causing the primary open angle glaucoma?
Well, age is a factor. So the older the age is a risk factor for glaucoma. We tend to see them in older age, the populations. So
Right.
above 60 and all that is more common than above 40.
Right, okay. But age is not the only contributing factor. Before we move along to the more different types of glaucoma, can you tell us what are some of the main reasons why glaucoma develops?
Well, that's interesting, because the word primary means we don't fully understand the true cause of the glaucoma. Although a lot of studies have been done to establish some risk factors associated
Okay.
with glaucoma. But we don't, so we know what are the risk factors from studies that have been done. So things like age,
Right.
certain ancestries like Asians, or in the Caucasian populations, they found that like the African Hispanic descents are more prone to glaucoma. If you're above
Right.
55, 60 years old, if you've got certain conditions like just now we were mentioning, if the prescription of your power of your glasses are very high,
Right.
again you're at risk of
You're at a
glaucoma.
risk. Okay.
But there are things like if you had trauma to the eye, injury to the eye, there is also a chance that you are at risk of glaucoma.
Right, independent of those factors.
That's right.
Okay, all right. That's interesting, because that basically means glaucoma has the potential to affect anyone, from
Anyone.
a baby to
That's
an
right.
elderly individual.
That's right. So we do see patients, and even babies born with glaucoma, and we call it congenital glaucoma.
Congenital glaucoma.
That's right.
Why
So-
would that, for example, occur?
Well, it's again
Is it a
related to
genetic-
the genetic does play a certain role. They found in studies that actually there is a genetic predisposition, so that if perhaps your mother has glaucoma,
Right.
you are at an increase at a higher risk of glaucoma, and that you should have your eyes screened, in fact, earlier than
right.
40 years old if
Right.
you have a
Much more
positive family
regularly.
history.
I
Right.
see.
But in congenital glaucoma, there is a structural and abnormality of the development of the eye per se that has predisposed to this or developed glaucoma in children.
Right. Okay. So basically, it would only worsen with age, for example.
Yes, and this congenital glaucoma, they are born with glaucoma itself. Yeah.
Right.
Yeah.
Okay. So let's go back to the different types of glaucoma. So you were talking about primary open angle glaucoma. So that's the most common. What
That's
about other varieties? There's around 6 different varieties, including
Yes.
congenital and primary.
That's right. So that's the primary open angle. You have the primary angle closure glaucoma. Then you
Okay.
have the congenital glaucoma that we see in children.
Right.
And we also have the secondary glaucoma. So when we say secondary glaucoma, glaucoma is due to a certain reason that we can find that it's attributed to. For example, like if you had an injury to the eye,
Right.
and perhaps the eye has had some bleeding and damage to certain tissues that can then develop later into glaucoma. So we call
Right.
it a traumatic glaucoma. You can have also certain features like pigmentary glaucoma, and these are just jargon, pseudoexfoliation glaucoma. They're just different types of glaucoma as a result of certain diseases,
factors,
yes, or diseases within the eye. And in fact, patients with diabetes, if they're poorly controlled, can develop into glaucoma as well.
Right.
And that's
so
a form of
an offshoot of diabetes.
Right. We call that neovascular glaucoma also, if that thing.
Right. Okay. So there's a whole host of factors and risks that are associated with developing glaucoma.
That's right. That's why it's a very complex disorder, and sometimes it's actually difficult to treat as well.
Right. Okay. Now, speaking about before speaking about treatment, let's go into the diagnosis of it itself. So let's go through like a step-by-step procedure. So let's say patient X comes in for their annual eye checkup.
Sure.
What sort of things would the doctor be looking for, would the ophthalmologist be looking for to see if he or she can clear the person for glaucoma or diagnose?
Sure. So again, when we see patients X who comes in, again, history is very important.
Okay.
We've got to ask them about the family history, whether they've got anybody or any relatives who had glaucoma. We've got to ask them whether they've had any eye injuries before. The other thing is need to ask them whether they're on any medications. For example, they could be on long-term steroid therapies. If they're asthmatic, they could be on inhaled steroids for their asthma. So steroids and things like that. Sometimes even Chinese medication and things.
TCM.
Yeah, that's right. So medication play an important part also. So we need to ask them about these things during the history, apart from the examination. Then we come to the examination.
Okay, and what does the examination involve aside from, so this glaucoma can be diagnosed during the visual examination?
Right, so when you come visit the eye doctor, usually we'll check your vision and see whether you have 20/20 or 6/6 vision.
Right.
And we also check for your prescription of your glasses, see how much power you have. But glaucoma specifically, we need to measure your intraocular pressure.
Okay.
We need to look at the nerve at the back, your optic nerve. And we also need to perform certain tests.
I see.
To rule out whether you do have or do not have glaucoma.
Right. So how does the doctor check for IOP, intraocular pressure first? Is there a device of sorts?
Yeah, there are various devices nowadays in the market. So you can use one of those that we use the microscope, like a Goldmann tonometer. Some are handheld, some uses the air puff. Again, variable amount of accuracy between
really
different things. That's
what's
right.
Available
That's
where.
right. Not particular, but as long as you get your intraocular pressure measured and make sure that it's normal.
Right. Yeah. Okay. What is normal intraocular pressure? Typically speaking,
generally studies have found that the range of intraocular pressure varies from about normal is about perhaps 10 to about 20-21 millimeters of mercury.
Right.
And the average where most people tend to fall in is about 16.
Right.
I think, yeah, that's right.
Okay, so anything which is aberrantly higher.
That's right.
Or lower.
Would not be so ideal. That's right. Too low is also not too good. Too high is also not too good. Right.
Okay, so that's what sets off a red flag.
That's right. That's right. So if you come in for an eye examination, you could be just coming for an eye check and said my vision's perfect, or so, and then the doctor measures your eye pressure and it's 30 or 35.
Right.
It could be because in the early stages it's asymptomatic, and so that raises the red flag.
Right.
And that would sort of prompt us to carry out investigations to rule out glaucoma.
Right, go further. Okay, all right. So good to know. Now let's hold that thought and we'll take a quick break. And when we come back, we'll be talking more to Dr. Lim Sien Han about glaucoma and all its various manifestations. Stay with us.
Not because I like to travel. I travel so I can say this. What you're looking for is inside of you, and you should be in peace.
Prem Rawat has been traveling for 40 years, inspiring people around the world to find peace within.
I go and I talk to people, and I present them with the possibility of themselves discover the peace that lies within you.
Kavita, Meling, dah set ke belum?
Sikit je lagi, Puan.
Apa menu kita hari ni?
Semua menu sihat. Ikan bakar, sup ayam, sayur-sayuran. Banyaklah.
Puan, banyaknya guna minyak. Bahayakan kesihatan lah.
Betul lah macam ni. Saya dah kurangkan separuh dari biasa ni.
Cuba rasa ni, sedap tak?
Biar kurang masin, jangan lebih.
Betul tu. Kita kena kurangkan minyak, gula,
Garam dan santan dalam masakan. Barulah ramai pelanggan datang ke kedai kita.
Semuanya
sihat belaka.
Menyelami realiti, menjejaki masa, meninjau peristiwa, paparan kronikal kembara kehidupan, pelbagai keunikan juga pengalaman menarik. Segalanya disorotkan selama setengah jam dalam channel Bernama setiap Ahad jam 9.30 malam hanya di Bernama TV.
Welcome back to The Nation. You're with me, Tamina Kausji, and it is Monday, the 16th of March, and we have with us in the studios Dr. Lim Sien Han, consultant ophthalmologist from Tun Hussein On National Eye Hospital. So, Doctor, we were talking about glaucoma and its various manifestations. Now, as we were saying, there are various types of glaucoma, and it is hard to treat. So, you said that once one goes in and you have the IOP pressure test done, if there's a red flag, what does the doctor do next?
So there are a couple of things that we do. So we need to carry out a thorough examination of the eye after that, and we need to examine both eyes, obviously. Then we need to also look at the angle for the reason that we're trying to place the patient in the category of the open angle or the narrow angle. So we do what we call a gonioscopy, and we look at the angle and we determine whether it's open, narrow, or how narrow it is.
Right. And how does an ophthalmologist perform a gonioscopy?
So the gonioscopy is performed where we are sitting with a slit lamp microscope.
I see.
And again, we can use various lenses that we place on the eye, and that lenses will help us look at the different angles of the eye, and determine how narrow or open it is.
Right. Okay. All right, so now we're going to be having some graphics on the screen. Now, could you explain to us what this is about, really?
So the picture on the left is a normal eye, and the right is the eye with the glaucoma.
Right.
And what the picture is actually showing is the effects of the intraocular pressure onto the optic nerve at the back of the eye.
Right.
So if you have a very raised intraocular pressure, there can be some mechanical damage or vascular damage to the optic nerve, causing optic nerve damage, resulting in glaucoma.
Okay, so basically it's pressure on the optic nerve that causes it.
That's postulated as one of the theories.
One of the reasons.
That's right.
Okay, and so basically this also shows an
eye
eye affected by
glaucoma.
Right.
That's right.
Okay, now let's have a look at the next clip. So this is typically an eye affected with glaucoma?
That's right. If the eye, so we can actually have patients who are symptomatic or patients who are asymptomatic for glaucoma, and sometimes patients can come with very raised intraocular pressures being very high, the eye is red, the vision can be blurred, they have headache, they can have vomiting, and this is like an acute attack of glaucoma. And that's why you can have this.
So it does have other physical manifestations as well.
That's right.
Aside from just the eyes.
That's right.
Okay. And what about an eye that looks like this?
So this also is another appearance of an eye with an acute attack of glaucoma. So you can see that the eye appears to be the cornea appears to be rather hazy.
That's right.
As a result of the raised intraocular pressure, the red arrow is showing you that the eye is injected and red, and it's just an acute presentation of glaucoma. So glaucoma, you can actually have a very asymptomatic kind of presentation, or one that's very acute, where they present with sudden attack of pain and all this redness and all this headache and vomiting. Right,
so it goes all the way from one scope to the other. And the eye drops are a common treatment prescribed for glaucoma.
That's right. It's one of the treatment arms for glaucoma, and there are many different types of eye drops available. but most of us tend to prescribe drops as the first-line treatment for glaucoma,
Right.
for primary open-angle glaucoma.
All right, for the most common
That's right.
type of glaucoma. All right. Okay, so basically what is essential is early diagnosis.
That's right.
And the main way to do that is by ensuring that you go for your annual checkups.
Exactly.
All right.
Exactly.
Okay. So at least that's a comforting thought to know. And let's talk a little bit about World Glaucoma Week, which was just last week from
That's
the 8th to the 14th of March. Could you tell us a little bit about the activities that Tun Hussein Eye Hospital conducts annually and
Sure.
this year as well?
Sure. So annually at World Glaucoma Week, our hospital will have a free screening for the public, and it's
Okay.
performed at our Tun Hussein National Eye Hospital or the Malaysian Association of the Blind. We also have we set up the patient awareness posters, things to create more patient awareness during the particular week, and there
Right.
will also be free talks and screenings done for the patients.
Right.
To try to pick up the glaucoma among the population.
Right. So basically, this is something which happens free of charge once a year.
That's right.
Right.
That's right.
Okay. Good to know. Now, as we were talking about glaucoma, now who is at a higher risk, especially amongst the elderly, for example? Are there people among the elderly who are more likely to be developing glaucoma?
Yes, that's right. So we found out that studies that have been done that glaucoma is more prevalent in the older age group,
Okay.
and people in this older age group tend to also have more medical conditions. So
Right.
perhaps if you, and they also take more medications as well. So again, back to the thing where we ask the history again, if they're taking steroid therapies or if they have certain conditions that make them have to take oral steroids or asthma, so those kind of things that predispose you to or make you at an increased risk of developing glaucoma. So
Right.
again, diabetes is the other factor there, which is and diabetes is getting more and more common nowadays. So again, diabetes is also one of the risk factors for glaucoma, and
Right.
especially if the diabetes is poorly controlled.
Okay. And what is the reason why poorly controlled diabetes might result in development of glaucoma?
So again, we found that patients with diabetes have a higher risk of developing primary open-angle glaucoma, but they also can develop the secondary type of glaucoma, which is the neovascular glaucoma as a result of uncontrolled diabetes. So they
Right.
get diabetic retinopathy when the diabetes is not well controlled.
Okay.
And as a result,
retinopathy.
that's right.
All right. What
which
does
is
retinopathy stand for?
So retinopathy is a problem with the retina at the back of the eye.
Okay. At the back.
The whole of the retina at the back of the eye. Again, this is not glaucoma, this is something separate, but a sequelae of uncontrolled diabetic retinopathy might result
Can be
in
glaucoma.
lead to a neovascular glaucoma.
Right. Okay. So there's a lot of risk factors, especially for diabetes
That's
patients.
right. That's
Okay.
right.
Right. Any other sort of risk factors for the elderly, especially? How
Trauma.
about, for example, elderly folk with cataracts?
That's right. Cataracts per se don't usually cause glaucoma,
Right.
although
Okay.
in a very certain select cases they can, if the lenses have become subluxated, dislocated, or very intumescent, very swollen lenses, they can form a form of secondary glaucoma.
Right.
So yes, that's true. Cataract can cause glaucoma, although it's not common.
All right. So cataracts also can, though it's not common.
But it's not common.
Right.
That's
And you were also saying trauma?
Trauma, that's right. So any injury to the eye, and surprisingly, we find that a lot of young patients who come, or young patients come with glaucoma from trauma, is from shuttlecock injuries,
Okay.
from badminton,
Right.
things like that. So the shuttlecocks hits the eye, they get bleeding, they get injury to the angles, and you can get a form of glaucoma.
Right, but at the very least, that sports injuries related glaucoma,
That's right.
it does seem like at least it would be easily diagnosed.
Well, in a way, sometimes it's a little bit tricky as well, yeah, because
Okay.
they don't develop
How so?
immediately after the injury.
Right,
Sometimes
okay,
it
so
takes
it's not, X gets injured today, tomorrow
No.
he has blurred vision.
No, that's right. It can
okay.
develop months or years later.
Years later, even. Okay, so that's why, again, coming back to the eye exam, it's
That's
so
right.
important to have it.
That's right.
Right. So especially, let's say, for example, if I had a traumatic eye injury, it could be through whatever. It could be maybe I went swimming or diving or
Sure.
playing sports. So must go for your annual eye exam.
That's right. That's
Okay.
right. Couldn't
Right.
stress it more.
All right. Okay. Interesting. Now, because glaucoma is often called, as you said, the silent thief of sight, there's typically no pain or even symptoms. So, how does one safeguard against glaucoma aside from just the annual eye exam?
Well, it'd be good if we need to be aware of it.
Okay.
And-
where does awareness start?
Oh.
And where do you think awareness should start?
Well, awareness should start right from the family. From our part, from the hospital, is trying to educate patients and patients' family. For those who have glaucoma, to educate their next of kin relatives to have an eye examination, screenings and things, so that the information can be disseminated to the public and to create a greater awareness. And as well as to go to the media, and we have all this radio and things so that the greater awareness can be created, so that everybody knows about glaucoma and they don't miss if they have glaucoma.
Right, and it's not just something you learn in a science class.
That's right.
Right.
Because-
Okay, that's good. Now, also talking about glaucoma, is there any sort of statistics that talk about the incidence of glaucoma amongst Malaysians, especially?
Well, unfortunately, like Malaysian data, we don't really have that many, in a sense, for glaucoma per se. But what we have is our neighboring countries. So Singapore has done a lot of work on glaucoma.
Right.
And so, although population-wise, so that's the kind of data that we look at as well.
Okay.
Yeah.
Right.
So, although primary open angle is a more common type of glaucoma, but in Asian population we get a lot of narrow angle type glaucoma as well.
Right.
And the thing is, they found that about narrow type glaucoma is that the risk of blindness is higher than open angle glaucoma.
Okay.
So all the more reason the importance of detecting the narrow type angle glaucoma and
Okay.
treating it earlier. Because if they do develop, and these are the groups that develop the acute type of glaucoma, which the sudden pain and the redness and all, the risk of blindness is higher if they do develop the attack.
Right. Okay.
So it's very important to catch this group of people
Early enough.
earlier. That's right.
Right. So, am I correct in saying that the end result of all glaucoma cases is not necessarily blindness?
Not necessary. Not this
Right.
right. So glaucoma again is a manageable disease.
It's manageable.
Manageable
right.
disease, although it can lead to blindness. But if it's treated early and controlled, then blindness,
The chances of
it's less.
halting
Yeah,
the
that's
progression. All right. Okay, so what we'll do now is take a quick commercial break, and when we're back, we'll be talking more to Dr. Lim Sien Han about glaucoma, how to prevent, and how also to actively manage treatment. So do stay with us.
Current issues, latest headlines, illuminating visuals, everything right and now on Bernama News.
Sedar tak kita tuan-tuan dan puan-puan, keadaan iklim yang tak menentu sekarang ni. Perubahan iklim meningkatkan kejadian kemarau, derebu, banjir dan ia menyumbang kepada perubahan iklim yang berlaku secara drastik. Inilah dia faktor-faktornya. Yang pertama, asap dari kenderaan. Yang kedua, penebangan dan pembakaran hutan. Yang ketiga, pembebasan asap dari industri perkilangan. Dan yang keempat, pelupusan sisa buangan. Ini usaha yang Pak Abu buat, iaitu yang pertama, menanam pokok. Yang kedua, mengurangkan atau tidak menggunakan beg plastik. Yang ketiga, mengasingkan bahan buangan. Yang keempat, mengitar semula bahan buangan. Dan yang kelima, memilih barangan dari bahan kita semula. Ada banyak lagi usaha yang boleh kita lakukan. Antaranya, kurangkan pemanduan kereta persendirian dan banyakkan penggunaan kenderaan awam.
Anda adalah sebahagian daripada penyelesaiannya.
Menongkah batasan masa, mengupas isu semasa, jadi saluran pelbagai suara. Segalanya baru dan benar di Berita Bernama TV.
Welcome back to The Nation. You're with me, Tamina Kausji, and Dr. Lim Sien Han, consultant ophthalmologist from Tun Hussein On National Eye Hospital, speaking about glaucoma. Right, doctor. So as we were saying, so once a typical patient has gone past the eye annual exam as well as, let's say, diagnosis with glaucoma, now let's talk a little bit about what would be the type of steps taken to arrest the glaucoma, since it's not curable.
Right. So then we need to complete the eye examination. So apart from the gonioscopy that we were saying just now,
right,
we need to perform certain tests to identify and to also quantify the severity of the glaucoma. And
okay. So the test can actually measure how severe the glaucoma is.
That's right. That's
right. And what are the before we progress, what are the stages of glaucoma?
So the stages of glaucoma roughly can be categorized as mild, moderate, and severe, and there are various different classifications that one uses for it, depending again on the type of tests that we use for glaucoma.
Right. So let's say if an individual has mild glaucoma, how would that present itself, physically speaking?
Mild glaucoma might have no symptoms.
Not at all.
Yeah. It
Right.
could just be a routine examination, or somebody who has had a father or mother or family who has glaucoma and just walked in for an eye examination.
Right. So then how would a doctor and ophthalmologist especially go about the tricky business of diagnosing
glaucoma? So again, after doing that, we send them for the investigation, and some of the investigations can involve a visual field test, that is to map out the visual field in front of you for both eyes, and that would help us determine how bad your glaucoma is, or whether you do or do not have glaucoma.
Right. Okay.
Then
what is a visual field test?
Well, it's essentially the commonest one we use is a Humphrey visual field test. So you sit in the machine, which is like a big bowl shape, right? You place your head, and it's a patient response, and you press as you see the light that appears, and so that actually reflects the function of the optic nerve. It's a functional test.
I see, to see whether your peripheral vision
is
functional,
normal or not normal. It also measures your central vision as well, and in glaucoma it tends to affect the peripheral vision first rather than the central.
Right. Okay.
So
you may be meaning which you're able to see fine as long as it's straight on, but towards the sides,
you may actually have a field defect.
Right. So you may have blurred or lack of vision.
That's right.
Okay.
That's right.
All right. Understood. So that would be mild glaucoma.
That's right. That's right. So moderate would be a bit more damage, larger field defects, and of course advanced will have even greater field defects.
So basically it just progresses until the main vision, the main line of sight is more affected.
What they call tunnel vision.
Tunnel vision.
Right.
Okay. Now, what would a doctor typically prescribe for somebody suffering from mild glaucoma?
So again, it depends on a few factors. So again, the level of your intraocular pressure is important,
right?
And how high the intraocular pressure. Obviously, if the intraocular pressure is, as I mentioned, it's 10 to 20 or 21 millimeters of mercury is the normal range. If your intraocular pressure is 40 or even 50, then that's very, very high. And we tend to prescribe topical medications as the first line, like drops per se for mild glaucoma. But again, if your intraocular pressure is very, very high, we might have to prescribe more than one drop.
I see. Right. And could you explain to us how is it actually that the saline or the other medicated drops help to, control the glaucoma?
Right. So again, back to our understanding of glaucoma, we don't actually fully understand the cause of glaucoma, but the only factor that we can actually reduce in glaucoma is your intraocular pressure.
Right.
And that's been found to actually halt or reduce the progression of the nerve damage or the progression of the glaucoma.
Right.
So this is the only current method that we can do. So the drops actually reduces the intraocular pressure.
And
there's various mechanisms. Different drops work differently. Some actually reduce the amount of production of the fluid in your eye. Some actually enhances the outflow of fluid from your eye.
Right, so depending on each individual.
That's right. So there are different medications and they work differently.
Right.
And so some patients might be on various types of medication. Some can be on 1 eye drop, some can be even up to 3 to 4 eye drops.
Right, prescribed at different times, of course.
That's right.
I see.
Some drops are used once a day, some are twice, some are 3 times a day.
Okay, right. So basically the treatment would be similar for mild and moderate and even severe glaucoma, or does it vary?
It varies actually depending on the severity, depending on the intraocular pressure, depending on there are other measurements that we need to diagnose patients with glaucoma. We also need to measure their corneal thickness, front part of the eye, because we need to know whether that's normal or not.
Okay. What could cause abnormalities in the corneal thickness?
Well, so they've done studies to find that your corneal thickness varies between 525 50 micrometers.
I see.
So if your corneal thickness is thin, then the intraocular pressure,
average.
That's right. The intraocular pressure that we measure actually, then it could actually be higher.
I see.
So it's actually an indication of also what our intraocular pressure is, the actual representation of our intraocular pressure. So again, glaucoma is rather a complex disease, and it also is a complex thing where we need a lot of information from various different tests to bring all together.
Right, before you can compile it.
That's right. And to also know how severe a patient's glaucoma is and what stage they're in, and whether to start them on drops or whether should we do laser or whether you should do surgery.
Right, okay, so basically the treatments are, you've got drops, you've got laser, you've got surgery.
That's right.
Now, what are some of the challenges that you as an ophthalmologist face with prescribing patients drops to treat their glaucoma?
Right. So again, depends on the severity of the glaucoma and things. So some drops are very convenient, just once a day at night. Yeah, so in mild glaucoma, that would be my preference. That would be easy. Patients' compliance is also good. The problem starts when patients start using 2 bottles of drops, 3 bottles of drops, and you have to remember to put 2 times a day. Exactly, 3 times a day. And unfortunately, drops are not side effect free. They do have side effects.
Right.
They make the eyes go red.
Okay.
There can be stinging sensation.
Right. So depending on one's, social or work schedule.
Exactly. So some people say, "Yep, I'm going to work. I can't put. I forget sometimes and all." So it's a very practical issue sometimes. So again, there are developments into the formulation of the drops and things. So now they're coming with injectable drop, sort of from the drop things that last for longer, for 3 months and 6 months, all in research,
so
rather than putting the drop every day.
So a drop that goes directly into
around the eye or in the eye.
Or in the eye.
In the eye, that can last for a longer duration.
Okay, do we already have that sort of technology?
Unfortunately, no, they're still in trials.
Still in trials, all right. But it's hope for the future.
That's right.
Right. And how often is it that you yourself have seen patients who've had, for example, mild glaucoma, but it accelerates into moderate because of non-compliance?
We see it all the time, actually.
All the time.
That's right.
Right.
So it's very important again to keep re-educating patients about glaucoma, even patients who already have glaucoma and who are already on treatment.
Right.
Patients sometimes still default, and in the sense that either they forget their medications, if they're traveling, they don't bring their medications. After some time, their pressures are okay. They might think I'm okay, my vision's still good. because they only got mild glaucoma.
Right.
So
they get a
don't
little lax.
Yes, that's right.
Right.
And then when they come back to see you, sometimes when they come back when they are already more severe.
Right.
And that time that's a bit sad.
Okay. Yes. So I suppose it's a lot about the attitude as well.
That's right. That's right. And you've got to re-educate and tell the patient, remind them, don't forget to put your drops.
Right. So also I would think it's important for family members as well. Keep reminding.
That's right.
Example, if your father, your grandfather, somebody has it.
That's
right. Okay. So that is for the treatment of mild glaucoma. Now let's talk a little bit, doctor, about laser. How can laser be used to treat or more accurately to halt the progression of glaucoma?
So there are various types of lasers available and again depending on the type of glaucoma that you have. So the one that I was saying earlier about the narrow type of angle glaucoma, and you want to prevent an attack of glaucoma in this patient, so we have to perform what we call laser peripheral iridotomy to prevent these attacks in patients with glaucoma.
Right.
And again, these patients, if we do detect them, they have to the eyes. We advise them for the lasers, and usually in both eyes. So that's one form of lasers. Then you have the other type of lasers that's something you can apply to the primary open angle glaucomas, they can either be what we call as a selective laser trabeculoplasty. So it's different kind of lasers applied at different parts of the eye in order to try to reduce the intraocular pressure.
Right.
Again, back to trying to reduce the
pressure, right. And basically, to my understanding so far, the lasers would be utilized because the patient doesn't have the time needed for it to be treated via drops? Or
not necessarily. Sometimes it's an adjunct or to augment the treatment. Again, glaucoma, it's very complex, so you have to individualize the treatment to the patients.
All right.
And sometimes drops have side effects. And certain patients actually might have more side effects to certain drops than the others. And some patients can be having allergies or side effects to multiple drops.
Right, the combination
that's maybe. Right. And so laser might be a better therapy for them rather than drops. But sometimes patients are on drops and we do lasers as well to try to bring down the pressure further.
So it really is a case-by-case basis.
That's right. It's an individualized treatment for glaucoma.
Right. And so the lasers, they help to relieve the intraocular pressure as well.
That's right.
Okay. Right. So basically, let's say an individual with moderate glaucoma going in for the laser treatment, what can they expect?
Well,
do you need to be hospitalized? Do you need to be...
No. So usually
it's an outpatient procedure.
It's an outpatient procedure.
Right.
Usually not very complicated in the sense that it's about maybe 15-20 minutes per se.
I see.
You sit in a machine very similar to a slit lamp examination. You would under topical anesthesia, and usually I tell my patients that you just see bright flashes of light, right?
All right.
And it's not very painful actually.
Right. But there's some sensation.
There is a little bit of sensation, that's right.
What is the aftercare like once an individual has had laser surgery?
Usually we'll prescribe them with some drops to use for maybe a week or two, and the aftercare is just wear sunglasses, and they should be usually quite fair, to go about their daily activities.
Okay, so basically it's just all about keeping the eyes safe and protected.
That's right.
Right. Okay, now moving along to the final type of treatment or to slow down glaucoma, how about surgery? What types of individuals typically go in for surgery?
Again, the surgery we perform, usually the indications for it would be either one, the glaucoma is progressing
rapidly.
That's right. Despite being on treatment per se, or if you've attempted lasers and things, or if their glaucoma is very advanced, they've come to you and their glaucoma is very advanced, right? Because sometimes drops just don't bring the eye pressure down low enough. Certain types of secondary type of glaucoma will need surgery as well because the drops won't work. Patients
Not
are multiple.
enough.
Yeah,
right.
That's right.
So it all depends on each case by case.
That's right.
Okay,
that's
right. So we'll take a short break, and when we're back, we'll be discussing more about the types of treatments which can be undertaken by people suffering from glaucoma. So stay with us.
kasih. Sama-sama. Terima kasih. Sama-sama.
Terima kasih.
Sama-sama.
Terima kasih.
Sama-sama. Sama-sama.
Satu cerita, satu bangsa, satu Malaysia.
Halo, apa kabar pemirsa? Salam dari Jakarta. Sebuah program kerjasama Kantor Berita Indonesia Antara dengan Kantor Berita Malaysia bernama kembali hadir menjumpai Anda.
Welcome back to The Nation. You're here with me, Tamina Kausji, on Monday, the 16th of February, and we have in the studios with us Dr. Lim Sian Han, consultant ophthalmologist from Tun Hussein On Eye Hospital, and we've been talking about glaucoma amongst the Malaysian population. All right, doctor. So, as we were saying, so surgery is one of the last resorts in trying to help reduce the effects of glaucoma.
That's right, but sometimes occasionally we have to. Surgery can be also the first line of treatment.
The first line of
That's
treatment,
right.
depending on when the patient comes in.
That's right, and the severity of the glaucoma.
Right. Now, how does surgery differ from the laser?
Well, we can achieve lower intraocular pressures with surgery that sometimes is not achievable with lasers or eye drops.
All right.
But surgery again comes with its risk, and so you got to balance against the risks and benefits to the patients.
Right.
So
and
performing surgery itself, sometimes you are also things like infection can happen, bleeding can happen. So you've got to explain to the patients that these things can happen, and again discuss the best option for the patient.
Right. Okay. So speaking of surgery to relieve intraocular pressure, how would that work in a technical aspect? Could you explain to us?
So again, there are various types of surgery available, and so by far the commonest is from what we call a trabeculectomy.
Okay.
Right, and trabeculectomy involves making a small opening in the white. That's right, in the white part of the eye. So we allow fluid to drain out of the eye.
Right, because that's what's causing the pressure on the retina.
So on the optic nerve.
On the optic nerve.
That's right.
All
so
right.
when we drain out the fluid out of the eye, on the anterior chamber of the eye, then we actually reduce the intraocular pressure, and that hopefully reduces the stress on the optic nerve and reduce the progression of the glaucoma.
Right, but that does sound like a really, really micro procedure.
And that's right. The surgeries are performed under the microscope.
All right. Okay. And typically, what would the recovery period be like after a surgery for glaucoma?
Usually, the recovery would take, depending on the recovery of the patient and the pressure, it can take from 2 weeks to 2 months, depending.
Right.
So there are a lot of visits to the doctors as well during
Follow-up
this
appointments.
initial period. And apart from the trabeculectomy surgery that we do, sometimes we put tubes into the eye drainage implants into the eye.
Right, okay.
So again, depending on the type of surgery we do,
that sounds quite invasive as
that's
well.
Right. So,
right.
Yeah.
Okay. And typically, what are the success rates of the post-surgery?
Success rates will actually again depend on the type of the severity of the glaucoma.
Right, the severity is
that's
key.
Right, the level.
So the earlier you come in, the better it is always.
That's right. So we also perform surgeries on very, very advanced glaucoma as well. So
I see. And what would very advanced glaucomal surgery look like? How would it present itself?
Usually patients would have blurred vision and also, remember we were talking about the tunnel vision that we're talking about. So when we do those tests of the visual field tests or when we do, there's another test that we didn't mention, which is an OCT or a measurement of the thickness of the nerve fiber layer of the optic nerve at the back.
Right.
So again, in glaucoma that becomes thin. So with all these tests, if we have the tunnel vision and all that, a lot of field loss, and that's considered advanced glaucoma.
Right.
So
there are many ways in which a doctor can classify it as advanced glaucoma.
That's right. And sometimes we have to tell patients that we're doing the surgery to try to preserve what you have.
Okay, right.
But actually, we can't actually reverse the damage that glaucoma has happened.
Right. So very importantly.
That's right.
Right. It doesn't reverse because it's not curable, but it is manageable.
That's right.
Okay, that's very key, I think. Right. So how do ophthalmologists who are all qualified to diagnose glaucoma, but how do you deal with, for example, patients who are not willing to understand that this is how serious the situation actually is, the condition is?
Right. So again, it's very good if they have, especially if they come to the doctor to visit, to bring somebody, a family member, somebody who is also interested to know.
Just for moral support as well.
And also to tell and educate them about the glaucoma process. You have nurse counselors and also tell them about glaucoma and also the importance that you can go blind if you don't treat your glaucoma.
Right, so you can go blind.
That's right. And they found from studies that actually blindness is actually associated with depression and also a great cause of morbidity towards the patient and the caregivers. It gives a lot
of course.
It
does put a person in a completely different mindset. Right.
That's right.
Okay, now let's talk about a couple of common myths that surround glaucoma before we sign off for today. Now, for example, if I'm a contact lens wearer, and I am, and my vision is poor, so does wearing contact lenses for very long hours, for example, increase the risk of developing glaucoma?
Usually not contact lenses. Contact lenses usually will cause things like dry eyes and things like that for prolonged wear. But glaucoma per se, if you use contact lens for a long period, usually they don't develop glaucoma.
Right, okay. And also people think that, okay, if I have 20/20 vision, no symptoms, I couldn't have glaucoma. What do you have to say to that?
Well, that's not entirely true, because you can have 20/20 vision, 6/6 vision and still have glaucoma.
That's right.
So early glaucoma affects the peripheral vision. So by the time it affects your central vision, which is your 20/20 vision, then it's already late.
Right, there you go. So that's the error in judgment that people make. Nice. Now, and glaucoma only occurs if you have elevated eye pressure?
Not necessarily. So we have a subgroup of patients called the normal tension glaucoma or low tension glaucoma. So these are patients with normal intraocular pressures, or what we think is normal intraocular pressures within the normal range, but they still have optic nerve damage with field loss.
It's accessory.
That's right, an optic nerve appearance that have the appearance of a glaucoma, but have normal eye pressures.
Okay, so there you go. So it can present itself in so many different ways.
That's right.
And also, finally, glaucoma is inherited. No one in my family has it, so I couldn't have it.
Again, that's not entirely true.
Right.
Although family history is important, but you can have glaucoma without any family history.
Right. Okay. All right, so thank you so much for your time today, Doctor. You've been a treasure trove of information.
I hope so.
And I think the main message we hope to drive home to all our viewers is that glaucoma isn't curable, but it's manageable.
That's right. That's right.
So go ahead and make sure that you go for your annual eye exams, no matter your age, regardless, but especially if you're over 40. And do make sure that you keep aware about glaucoma and all the health risks that are associated with it. This has been The Nation on Bernama. I'm Tamina Kausji, and thanks so much for joining us today.